In my practice, I see a lot of people with knee pain. So I thought it was time to do a video to show you some massage techniques that you can do right on yourself to alleviate that pain. You're going to want a chair, and the height of the chair should be such that your knee should be bent 90 degrees or as close to it as possible. All right? You can be clothed during this, or you can wear shorts or underwear. Of course, for the sake of the video, I need shorts, otherwise it would be another video entirely. So you want to start by just brushing up to warm up the thigh. So what we're going to do is work the quadricep muscles, which are a major group of muscles that act on the knee. Primarily, they work to straighten the knee. So just brush up, warming the tissue. We go from down to up to encourage circulation upward towards the heart. When you feel like that's pretty warm, start closer to the knee. I want you to take your hands like this and do a spreading motion. So we're just spreading the tissue. Now, I made it so that you can see my upper body. I'm not doing this, I'm not pushing. I'm actually keeping my back straight and leaning into the tissue. This is going to save your arms from getting tired and also your back from hurting. It's a bit of a catch-22 when we do self-massage. We have to make sure that we don't hurt the rest of our bodies so that we don't need to then massage other parts and then get sore in other parts and so on. So we have to keep our body safe. So just leaning in, kind of a hooking the tissue. You just lean in as much as is comfortable till you have a nice firm pressure, and just let your hands slide out on either side, just taking the tissue with them all the way up the thigh. Breathe while you do this. Leaning forward, leaning into it. Okay, I'm going to move forward a little so I can get up higher, and just try to keep your shoulders relaxed here as you lean forward, spreading. All right, next thing we're going to do is you're going to take your fingertips and just give a little circular massage around the kneecap. This should feel really nice. I'm just going circle, 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 right around the patella, the kneecap. Doesn't matter what direction. You can use as much or as little pressure as feels good here. And then we're going to do another spreading, taking the fingertips this time at the base of the kneecap, and just gently, I'm leaning back. Gently leaning back and spreading the tissue up and around the kneecap. So I'm outlining the kneecap basically, just going out and around. Okay, go ahead and take the tissue, almost like gently cradling the knee and leaning upwards away. Again, back is straight and I'm just leaning back. I'm not pulling, I'm not yanking, just letting my weight take my hands here. Okay, now here's a technique. It's pretty advanced, but I think you'll be able to do it quite well on yourself. Take your knuckles, soft knuckles, and place them right above the kneecap. And what you're going to do is lean into the tissue and begin to start dragging the tissue upward. So lean in so that you have a nice firm pressure, but not so much that you're hurting yourself. Okay, and what you're going to do now while you're dragging upward is straighten your knee and bend your knee. Straighten and bend. You might feel some sore spots. I'm right in the middle of the thigh right here, right on top, on a muscle called rectus femoris. It crosses the hip and the knee joint. So if you find a place that feels sore, you can relax and just lean into it and take a few deep breaths. If it's sore with your leg like this, you might want to straighten your knee. That slackens it a little bit, and you can just lean in, release some tension, and then continue up along your way. Try to keep the knee and the toes facing in the same direction. pointed up towards the ceiling. Okay, get as high as you can. Ideally, you want to get all the way up to the hip bone. Then you want to do the same thing, but widen it a little bit. So now I'm going on either side of that muscle that we just worked. So a little bit on the inside with the inside hand, a little bit on the outside. Okay, and same thing. Straighten, bend. Just leaning back with the body. As much pressure as you can without hurting yourself. Okay. Then we're going to do even more outside. Try to avoid going right on the IT band. It's just painful, and actually studies have now shown that you cannot stretch the IT band. So for all of you who go to the gym and roll out the IT band, you're basically giving yourself a lot of pain for no reason. There is no mechanical force that is going to stretch that band. It is a thick piece of fabric that is not going to be manipulated. So you want to go right above it where sort of your quads attach to it, okay, on either side. And then the inside, be a little more gentle on the inside of the leg. That's where nerves and blood vessels are a little more towards the surface, right under the skin. So you could put more pressure here on the outside than the inside. And straighten and bend. Straighten and bend. This is called active release. Very good. So we'll just finish by brushing off here. And I always like to take into account the opposite muscles, the antagonists. So whereas the quads straighten the knee, the hamstrings bend the knee. They're the opposite. So let's go ahead and just underneath the leg, go ahead and brush up to warm up those tissues. And then take the tissue in your hands together like this and pull down. So get a nice grip and pull down. Try to keep them really relaxed so they're nice and slackened so you can grip and pull. Grip, pull. Grip, pull as far as you can get up to your sit bone. Now let's do the opposite, and it's that spreading motion. So we're going to put our fingers right in the middle of our hamstrings here and lean back. So we're spreading. And if you're doing your leaning and you're leaning into and you're leaning away throughout this, you shouldn't feel any fatigue in your arms at this point, because really it's your body, it's your core, you're using your weight to do all the work, not your hands, not your fingers. And that could take some practice, so just keep thinking about using your weight to make it effortless. And pulling kind of away and also upwards. Okay, and by giving a little brush upward all around the leg, give the knee a little extra love, a little extra rub around. Great. Just rest your hands on your thigh and take a nice couple breaths. And notice how it feels, if it feels any differently than it did before, if it feels more relaxed, if it's tingly, any sensations that you might notice. And of course, you're going to then repeat this on the other leg. Now, of course, this doesn't substitute a professional massage, but it will help to alleviate your symptoms and can also prolong the benefits of your massage treatments to make them extend in between your massage sessions, which is really beneficial. Got to do your homework. So for more information like this, go to my website. It's rachel-richards.com. Please subscribe to my newsletter. It's free. And subscribe to my YouTube channel. I will see you next time. Thanks.